Hello everyone, I'm Dr. Sisi. Welcome back to my channel. If you are here, you are probably wondering, am I just having PMS or could I be pregnant? This is a super common question because PMS and early pregnancy symptoms can look almost identical. But there are key differences that you can watch out for. In today's video, I will break it down step by step so you'll feel more confident about what is going on in your body. First up, let's talk about PMS. PMS stands for premenstrual syndrome, and this usually occurs few days to few weeks before your period starts. Some of the common symptoms that people may experience when having PMS are abdominal cramps or lower back pain. Some people may even complain of nausea and vomiting. Some may experience bloating. Some may even experience irritability or mood swings. Some may also complain of breast tenderness, and some may even experience food cravings. All these are caused by hormone fluctuation, especially a drop in the estrogen and progesterone just before the period starts. Now, let's look at early pregnancy symptoms. This can start few days after conception, but are noticeable after a missed period. Common early pregnancy signs may include a missed period. Of course, this is the biggest clue. Some people may also experience breast tenderness, but this is often more intense than the PMS. Some may experience nausea and vomiting, or what we call the morning sickness, but this usually starts about 6 weeks after conception. But this can actually start earlier in pregnancy. Another symptom that some people might experience is implantation bleeding, and this is just very light bleeding, what we can also refer to as spotting, before your mixed period. And this can actually happen about 6 to 12 days after conception. Some may experience bloating. Some may also experience fatigue. So some people might notice that they are feeling unusually tired all the time. This might just be a sign that they are pregnant. So while there is overlap in these symptoms like sore breast, cramps, moodiness, fatigue, nausea, pregnancy symptoms often stick around after you have missed your period. So, how can you tell PMS and early pregnancy symptoms apart? There are key differences you want to take note of to be able to tell the difference between PMS and early pregnancy symptoms. So here are a few things you might want to take note of. First, timing. If your period is late, that is the first clue. PMS usually stops when a period starts, but for pregnancy symptoms, they keep going, especially after a missed period. Another thing you want to take note of is implantation bleeding. Implantation bleeding is usually lighter than the regular period, and it actually lasts for about few hours to some days, at least 2 days. And this usually comes as a pink or brownish discharge, and it might actually occur around when you are due to have your period, so it might actually be mistaken for an early period. Are you experiencing nausea, feeling queasy, or vomiting? It's actually common in both PMS and early pregnancy symptoms, but it is actually much more common in pregnancy than PMS. Breast soreness can actually feel the same in PMS or even early pregnancy. But another thing you might want to take note of is the areola. It might darken, or some people might even notice some distended veins on their breast. So this might just be more of a pregnancy sign than PMS. Experiencing fatigue. Well, feeling exhausted can actually happen with both PMS and early pregnancy symptoms. But extreme tiredness that doesn't improve with rest is more likely to be a pregnancy symptom. So, if you think you might be pregnant, the best time to take a pregnancy test is at least 1 week after your missed period, because that is when the HCG hormone will be high enough to be detected. If you get a negative test result and don't still get your period, wait a few days and take the test again. So there you have it. I hope this helps you feel more clear about what's going on in your body. But remember, every woman's body is different. So if you're unsure or notice you're having unusual symptoms, you might want to check with your doctor. So thank you for joining me. If you found this video helpful, please don't forget to give this video a thumbs up. And if you haven't hit the subscribe button, don't forget to hit that subscribe button and turn on your notification bells. See you next time. Bye.